Hi, Sunita. Thank you so much for giving the time today for recording this call and taking the
My
feedback.
pleasure. My pleasure.
Perfect. Amazing. So, yes, I do have a few questions to discuss about the program and your journey so far. So, first of all, what are the goals you had when decided to join the program? What are the things you wanted to work towards?
Okay, initially, see, I was looking for weight loss programs and
Mm-hmm.
weight loss and my gut related issues. So I
Yeah.
just spoke to my husband about that, and then he was like looking for it, and then he came up on this Roshni's site, and then he said ki there is this dietitian. I think because it was mentioned that it is the like it is
Mm-hmm.
mentioned about autoimmune disease as well.
Right.
So that was my main concern because I have an autoimmune disease.
Yeah.
So that's how I it was through Google search and everything I got to know about it. And then yeah, my
Mm-hmm.
primary goal was to the autoimmune disease and then my gut and my weight loss. But then as the
Yeah.
program started and everything, weight loss it became secondary because my other issues were more important, like my cholesterol and my diabetes, which was on border
Yeah.
high.
Yes, amazing. And also, it was when it comes to your gut health, I would say it was a greater difference when it comes to when we started initially the symptoms that you had and after when you had
Yeah, I mean, my
good
gut health, I would say it has definitely improved because I never knew like taking dairy products, that could have been one of the reasons for my gut. And
health.
now, like, since this program has started and when I stopped the dairy products, so that has actually, I feel it has helped me. Initially, I found it a little difficult for week 10 days, to shift to
Yeah,
dairy, non-dairy products, and then because I was so used to having that cup of tea in the morning with milk.
I
Uh,
know.
so initially it was difficult, but slowly, yeah, I changed it, and now I can see a lot of difference in my with gut related issues because like
Mhm.
earlier, I would have like a lot of bloating, acidity, gastritis, and all that, which has come down after stopping all this.
Yeah,
Dairy products. So, and then, like another reason was initially what would happen was I would always have this severe gastritis, and because of that, I would have pain in my chest and which would come to my throat.
right.
And that had become very frequent before I started the program. So after I started the program, that has come down actually because that
Right.
pain would be like very severe. So it has happened like 2 or 3 times in the whole 3 month program, but it
Yeah.
was not that severe.
Hmm.
So this has definitely helped me.
That's good. And yes, as you were selling, I remember initially it was a little difficult for you to cut down your daily tea. That has
Yeah,
become a habit for a long time, but it did
because
really
it's
good.
been like almost
I would say,
47 years that I'm not 47, maybe
uh,
40 years or something. I've been taking tea in
yeah,
my breakfast, and then I was so used to it having that morning tea. Like
yeah.
evening tea also, I was okay to skip the evening tea because it was on and off happening, but morning tea was a regular thing.
Mhm.
So initially, even after I started the program, I think for 1 2 weeks, I think I have taken tea with normal milk, and then slowly I shifted to soya milk and all those things. And now I'm kind of okay with taking milk with I mean tea with soya milk and all that. So my dairy has stopped.
Yeah, that's actually a really good change, and I know it's not very easy
Yeah,
to just
it was not
every
easy initially. Like for 10 15 days,
uh,
I found it really difficult to kind
but you
of
did good.
shift from dairy to non-dairy, and then yeah, and like I could see the difference.
Yeah, that's amazing. And yeah, in terms of dietary changes, you have changed a lot in terms of cutting down your processed food and minimalizing your, eating out frequency as well.
Yeah.
Apart from these dietary changes, what would you say as top three lifestyle changes that you have made on your day-to-day basis?
So lifestyle changes that I have done is like earlier I would not eat like green leafy vegetables. It would be
Uh,
like say 2 or 3 times in a week it would happen. But
mm,
now that is a major thing that has changed in my life because every day I'm having
yeah,
green vegetables in my smoothie, and
right.
otherwise also in my food, I'm having some or the other kind of
Yes.
vegetables and fruits, and like I've started eating a lot of salad now, which I would like, I would, for me salad was just cucumber, tomato, onion, radish and
Yeah.
carrot. But now I've started taking whole lot of other salads, and I've included lot of millets and legumes and all these things in my
Right.
diet, so that has helped me a lot.
Mhm.
Sometimes I do feel a little like gaseous because of this kabuli chana and all those things. So I've
Mhm.
stopped taking that at night. So I
Yeah.
take kind of salad in the afternoon, and at night I make
Yeah.
it salad. So yeah, so those kind of changes has lifestyle changes have helped me. And then like I would not walk after my dinner or my lunch.
Mm.
Like, so that is one thing that I've started.
Yeah.
Uh, then, yeah, I think one more change was like as soon as I would get up in the morning, I would start scrolling the phone and it would just go on and on and on. So
Yeah.
that again, I do look at the phone, but then,
Mhm.
morning when I get up, I don't scroll the phone for like, like half an hour or 1 hour or something. I do look at the
Yeah.
phone, some messages or some call or something like that, but I
Right.
don't scroll. So I do scrolling only after say 12. So
That's
that,
good because nowadays we are so accustomed to wake up to check the phone, so that is how
yeah.
it's happening. So it's really, really great shift, and I
So,
know you have been also.
yeah, I mean, it's
Mm.
just been 3 months, and these lifestyle changes I have done, and I think slowly down the line, I think I'll just continue
Yeah.
with all things, and hopefully, all this, like the
Yes.
and all comes down to zero.
Definitely.
At least
Definitely. Yeah.
morning,
Sure.
at least in the morning.
Yeah, and you have been doing other good things also. It's not like your morning is boring now without your phone. You are going out, you're going for a walk, you're getting your sunlight exposure. So it's a good
Uh-huh.
way to, start your day. So I'm sure you will stick to it forever and it
Yeah,
will become a
and
lifestyle habit.
because nowadays what has happened is like exercise has become a part of my life, and
Yeah.
without exercise, it becomes like I just cannot think of a day. I mean, I start missing like there's some I'm missing something in my life. Like I if I don't exercise even for a day, then I start feeling guilty about it. Okay, I've not worked
Right.
out. That. So at least yeah, I'm
Mhm.
more health conscious now
Very
because
active. Yeah, that's good. And while talking about exercise, I know that you have also started your, dance classes and everything. So
yeah.
how would you describe, your energy levels like before, during and after the program? How would you compare it? Do you see any changes on that area?
See, energy level even before it was similar to what I have right now.
Yeah.
So I don't see any difference in the energy level because I was energetic earlier also, like before I
Mm-hmm.
started the, and
Mm-hmm.
I'm same like that now also. But yeah, I mean my like the gut thing which was bothering me a
Yeah.
lot. So that thing has actually come down, and I'm very happy about that.
Yeah, I'm so glad to hear that. And also looking at the values, it was a really massive change when it comes to
Yeah,
your
yeah.
cholesterol markers and your
Was
inflammatory markers.
before I got the reports, when I got my reports done in Feb, it was like all like border high. Most of the things are border high, and my
Yeah.
cholesterol upside down and everything. But last time when I got my reports done after the diet program I started and everything, so I was very happy about my reports. Like
Yeah.
my cholesterol was like it had come down. My diabetes, which was like border high, that came down. My
Right.
thyroid were like
Mhm.
good condition, and whole lot of other things like they just came in control, and I was like very happy about that.
Yeah, and inflammatory markers. I was also, like one thing I was really happy looking at the scene. I know we still have little way to go when it comes to your HCRP and everything, but it already
Yeah,
has started,
it
going
has
down
started.
drastically. That's
So I was
amazing.
just thinking, ki I'll just get one more, like maybe in next month I'll get another test done and see like the
Yeah.
comparison, how it is like,
Yes.
and whether I'm still
Please
in the
do
right,
it.
or I have deviated little here and there. I need to see
Right.
that. So next month again, I'll just go for a checkup, and then I'll just
Definitely.
share my reports, and then I'll
Yeah,
just
let's do that.
and probably I'll get another clarification whether I'm on the right path, or I need to. I've gone here, and then again I need to follow. I need to see that.
I know. Here, when you were on the program again, that weekly connection was there. So you know, I will be asking you
Ah,
questions.
yeah.
You were doing really good, but yes, again, even after that, make sure everything is going as per
No,
our
I'm actually following
routine.
everything. It's not that I'm not following. Yeah, like, when I'm
Yeah,
not
yeah,
having help, so that time it becomes like 70-80% of the diet I follow. So
yeah,
20% goes here and there. But more or less, I try to,
yeah.
uh,
That
even
go well.
if I
You
go
could.
out for dinner or lunch, I prefer, earlier I would eat whatever and anything and everything. But now, like, I make sure that I just eat tofu. I never
Right.
liked tofu, but I've tofu. I used to hate tofu, but now I've started loving.
That's
I mean, not loving, but liking it slowly. I
yeah,
miss
yeah,
also. So yeah, I mean, I've started added lot of like vegetables, lot of green leafy
mm,
vegetables, and then lot of fruits and lot
yeah.
of salads. So
And I
like
know
I
consciously, you know,
there
you
has
have
to be diversity in the food, so that diversity I can see in the food.
exactly.
And there it was not there.
That is really great. You know, one thing I loved about you and your routine is, you know, even if you are going out, you were still, you know, going out occasionally. You were still enjoying some food here and there, but still you were being conscious. And even if you are going to have a dessert, you will tell me, Padma, I'm going to have one dessert. Is it
Yeah,
okay?
yeah.
That is a really good thing. Yeah, no, being conscious. It doesn't mean you couldn't enjoy your social life or you couldn't go out, but you did it,
I
still did it
go
in a
out, but
healthier and better way.
yeah, I mean, sorry, but I used to go out and I would still like, make sure that I'm eating healthy food, like, which is vegan, which is
Yeah.
non-dairy food. And I would order things which are non-dairy and then I would eat those. And then, yeah, I would enjoy that also.
Yeah, and I
And
remembered you telling me that you wanted to have a dessert on one day you went out, but still you shared the half with your husband.
yeah,
You were still, you know, that's a good thing. You both shared a meal, a happy meal, but at the same time, you know, you enjoy your
I,
dessert. So,
I enjoyed it. At the same time, I had, you know, I
yeah,
was like very clear about, I need to kind of
yeah.
Uh, I need to enjoy, plus I need to take care. I need to see it is not overly eaten.
Right, exactly. And while talking about this again, how would you you know, how do you think your relationship with food in general have changed? Because, you know, generally people have this notion that only this food is healthy. This is like a villain, you know, we shouldn't touch fruits if we have high sugar levels or A1C. So there are so many fear mongers, you know, towards food generally when people trying to lose weight. How would you describe your relationship with food now?
No, I think what I feel now is like, like earlier also I have followed a diet program wherein I
Yeah.
was on oats. Like, there was a time, like,
Mhm.
for those 3 months or something, every day at night she would give me oats, whether oats in milk and all those things. And I was so fed up with oats. I was like, I had started hating oats. I was like, no. And now, like, now after doing this program, Roshni's program, I feel um, it is not about cutting down on your food. It is about eating the right amount of food and
Exactly.
quantity of the food. And like you said, there has to be a lot of diversity. And slowly, like, weight loss is a secondary thing which follows with all these things. See,
Exactly.
I lost like around 4 or 5 kgs of the weight of my weight in last these 3 months. It has
Yeah.
not been much, but but with the whole program, I'm feeling much more healthier.
Yeah, and lighter also. Definitely, that is happening with you being regular with your so much of physical activities and stuff.
Yeah,
So
yeah, all that is
that's
happening.
good.
Yeah. So now, right now, it is not like, you have to eat just one or two type of food, and then, I need to lose my weight. Now I
Correct.
whole lot of food with lot of lentils, legumes, millets, and
Uh,
everything, green leafy vegetables and everything. But then, I've not lost much. Like, I've just lost like 4 to 5 kgs in.
mhm.
But then, my overall health, that has improved, and
Yeah,
I think that is the main
yeah,
agenda. The health has to be important, because if the health is
exactly.
good, everything, then, everything else falls in place. So
Exactly. So this has been just a byproduct when we were
yeah,
working on your, you know, antibody levels, your thyroid and cholesterol. Automatically, again, this has become one of the byproducts, and I'm sure even currently you are continuing to lose weight. So I'm sure we will be there when it comes to the weight loss goal, and of course, all the efforts that you're also putting in.
Yeah, so now I've given myself like, one this time, I'll have to follow this diet.
Yeah,
Obviously, I'll get accustomed, like I have got accustomed to
yeah,
even more in the
right.
coming, because I just want to be healthy and lose weight in a healthier way, not just
Exactly.
one or two things and then lose weight and then you starve and then you have those cravings and all that. So
Yeah, doesn't
definitely,
stay long.
yeah.
Got it. I'm glad to hear that. And how would you say you had met with one of our amazing doctors, Dr. Maitri? So, how much would you say meeting her had an impact when it comes to your symptom management? Especially, I know your menopausal symptom and gut health have been changed a lot. How would you describe or talk about that?
See, meeting with Dr. Maitri was a bonus, I think.
Mm,
So she explained how, what about my menopausal system, my menopausal thing, and my gut and my autoimmune disease, everything. She explained me. She asked me to get some tests done and all those things. And like you said, the tests are not needed because
mm,
reports, I don't need to get done. So yeah, I think the best benefit that I've had is cutting down on those dairy products,
yeah,
and that has helped me, I think. So
yeah,
instead of getting the tests done also, which are like so expensive, so cutting down on the dairy products, and I can see the difference in my gut, mainly because that was something
yes,
bother me a lot. And I would have every now and then I would have bloating, acidity, constipated. I would feel constipated and everything, but touch wood, now things are
yeah.
in a better place.
Definitely, yeah. So glad to see where you are being here currently from where we have started. And yes, you still have a long way to go, but I'm sure you are already accustomed to your routine, like how you are telling me and how
Yeah.
you are currently. I could see that. So continue with the same routine. And if you could advise someone who's, maybe looking at your video currently, but thinking and still hesitating, to start taking care of their health, what would you advise them? What, like a tip, what would you give?
No, I think I would just advise that health is the major and the most important thing in one's life. If your health is good, everything else is good. If your health is
Yeah,
not good, thing is it does not make sense. If you're having gut related issues, and then if you base if you're doing something, I don't know. I mean, I feel like the advice that I could give is
mhm,
of your health, because that is the most primary thing. Baki
yeah,
sab, it follows up. But if your health is good, and if you're happy, then everything is good and happy. If your health is
yeah,
not good, not happy, then everything again gets irritated and frustrated. So that is on that,
definitely.
because
Definitely, yeah. So,
I can see the difference, and I'm actually very happy, with the kind of reports that I had, and
mhm.
the kind of reports now after doing the program I got. And overall, I think it has helped me so much. The 3 months program, yeah.
I'm so glad to hear that, Sunita. And it was, yeah, really amazing working with you and spending time with you over the last 3 months.
Likewise, it was amazing working with you also, Padmashri, because I think um, you're such a kind and nice person to talk with, and I could so easily connect with you. And I don't think so. I would have been that easily. I would have been able to connect that easily with anyone else, because
Thank you.
uh, your aura, your vibe, everything has to match. And with
Yeah.
you, I would actually look forward, I have a call with the Padmashri, and I would always look.
Yeah.
And the way you explained everything, this has to be done like this, and this is the reason why I'm not giving you this. I mean, throughout the program, you were of such a help. Like,
Thank you
thank you.
so much. It means a lot. Yeah, definitely. And
And
please stay in touch, like I
I
have told you.
touch with you, and if I'm having any issues, I'll
Yes.
keep messaging and I'll keep bothering.
Yes, please. Yes, please. Anytime. I will always be there. So please reach out to
Yeah.
me if you need something.
Def-
Take care. Yeah, take care of your health and reach out to me if you need
Thank you
anything. Yeah.
so much, Padmishri.
You're very welcome. Take care. Bye bye.
Yeah.